Today, we're going to talk about real world data surrounding our remote care program. What we're actually running inside our medical practice right now and how it performs financially and operationally. This is not theory, it's not a pro forma spreadsheet. These are real numbers, real staff, real workflows, and real audits. So, if you don't know me, my name is Randy. I run a multi provider endocrinology practice, and that practice serves as the real world lab behind MedProfit Lab. Everything we teach gets built, implemented, and pressure tested inside our own clinic first, and we assume that every program we do will eventually be audited because we have been audited, and we design our systems accordingly to that. So right now we manage approximately 450 active patients in our remote patient monitoring program, as well as the chronic care management program combined. Blended together, these programs generate over $100,000 per month in collections, and our average revenue per enrolled patient is approximately $250 per month. That's across RPM and CCM, depending on the payer mix and the complexity. So these programs are based on actual billing and actual reimbursement, not projections. This is real numbers I'm talking to you about. Supporting that revenue, it requires structure. We have three full time staff members that are dedicated specifically to care management, and their responsibilities include reviewing physiologic data, conducting required patient interactions, documenting time accurately, escalating issues to providers whenever it's clinically appropriate, and ensuring that billing compliance standards are met. So, this is engineered clinical infrastructure, it's not passive income. So, payroll, taxes, and benefits for these three team members represent the largest controllable expense in the program. On top of that, we have platform costs for RPM and CCM software. We account for administrative oversight as well. We account for physician supervision time. And when you subtract all these costs from collections, the margins are very strong, but only because the program is intentionally engineered and it's actively managed. If you don't know your revenue per patient, your cost per patient, your staffing ratio, then you're just operating blind. We're also layering in additional technology platforms specifically to incorporate continuous glucose monitoring patients, and we've already started approximately 150 patients in that program. So CGM improves the economic profile because there's no device cost and there's no like ongoing supply cost on our end as well, like there would be with a glucometer. However, it significantly increases the workflow complexity. So this is really a level two type of program. It's not the place that you start from the get go. With CGM, you have to have a system that allows your team to identify on a consistent daily or weekly cadence which patients require attention and whose time and range might be declining, who's trending towards hypo or hyperglycemia, who needs proactive outreach before a problem escalates. And without dashboards and structured review workflows and a clear escalation protocol, that data just becomes noise and it overwhelms your team instead of driving clinical value. The strategic advantage for us is that we already have trained staff reviewing physiologic data every day already. So, by incorporating a dedicated CGM platform into those existing workflows, we've increased our revenue per labor hour without doubling our fixed overhead. And that's how you scale intelligently inside of a medical practice, by increasing yield from existing infrastructure rather than simply stacking on new expenses one on top of another. Documentation discipline is non negotiable. We build all of our workflows assuming that an auditor is going to open the chart. And that's because we have experienced audits before. So we don't rely on vague documentation or like loose time tracking. Each CPT requirement has to be clearly supported in the medical record. We we don't respond to audits by just dumping like 50 pages of unindexed documentation and then hoping that they find what they need. We structure the records so it's obvious where the requirements are met, where they need to look, and that mindset protects the revenue, and it also decreases the future audit risk, because when we get an audit, we respond to it appropriately. It's easy for them to document. Then it's kind of like a plus one, plus one, plus one. So they don't continue to audit us on the same thing. They'll go and audit the person who fails an audit. The biggest mistake I see practices make is focusing only on the top line opportunity. So that's like focusing only on collections. They hear about RPM or CCM and assume that it's just easy money. They outsource everything under a flat per patient model without understanding the margin involved, and they fail to calculate like the time per patient. So they underestimate staffing requirements, and they build programs that either just collapse operationally, they fail under any kind of scrutiny, or the margin is just so low, it's not really work that's worth doing. So if you're currently outsourcing your remote care program under a fully managed model and you've never actually modeled your own margins, there's a very real chance that you're leaving significant money on the table. And when you understand the math, the staffing ratios, and the documentation structure, you can often build much higher margins while retaining control and audit visibility. And that's to say nothing about the better patient satisfaction and better patient outcomes. If you've never built a remote care program at all, whether it's RPM, CCM, or even layering in CGM on top of an existing program, we can help you design it correctly from the beginning so you don't make expensive staffing, technology, or compliance mistakes along the way. And that's exactly why MedProfit Lab exists. Our practice is the lab. We teach the things that survive under real world pressure. And if you're serious about building remote care the right way, and for us that's being profitable, defensible, scalable, and useful, then you can learn more at medprofitlab.com or just send us a message.